My name is Lewis Williams, and I was injured at work on January 14th, 2014. I'm a union carpenter, and I was working in French Lick, and we were setting some formwork down the pit. And as I was walking it down, the bank collapsed, and I fell about 4 foot and landed on, and my knee buckled and sustained a meniscus tear and ACL tear with a bone avulsion.
So Lewis came to me with complaints of right knee pain and instability from an injury he had about 6 or 7 months prior to presenting to me. His main complaint was that he couldn't trust his knee. When he was walking on uneven surfaces, the knee felt like it was buckling or giving way, and was quite a problem for him. Even walking around the home, the knee would occasionally give way and buckle, and he really didn't trust it. His physical exam was concerning for a tear of the anterior cruciate ligament, the ACL of the knee. And what that is, it's one of the 4 main ligaments in the knee. The ACL controls translation or limits translation of the tibia, or the shin bone, in this direction. It also pivots or spins, if you will, with an ACL tear. So there's a component of translation of the tibia moving forward, and there's also a rotational component, and he had that. He had both of those, and the knee was just quite unstable, even in a brace. And so based on that, we had a long discussion regarding treatment options. We discussed, he had already been to some physical therapy. We discussed continuing that, but he really felt like he had maximized that, and he didn't want to spend the rest of his life in a brace, and he was having some instability even in the brace. And so the treatment option at that point was really limited to surgery.
I have very high regard for Dr. Farrell. I feel like he was very open and honest with me about my injury and my prognosis, and was positive, but not like fake cheerleading. This is what you need to do. This is what you can expect. This is where you're at. And I think he did a great job with me. I'm very happy with my recovery. Very happy with the way my knee's holding up. And he said, "I think you're a great candidate for repair on that." And we talked about it, and when I left that day, I think I had an appointment to have surgery the next week, and I'm very happy with it. He was up front. He said, "This is what you're looking at. This is the damage you've got, what needs to happen," and gave me some different options and presented them all and let me pick, and I was very happy with the way it went.
There's multiple graft choices you can use to make your new ACL. You can use the middle third of your patella tendon, and so the patella is the kneecap in the center, in the front of the knee, and the patella tendon goes from the patella to the tibia, and so you can use the middle third of that. You can use some of your hamstring tendons. You have 4 of those. We take the gracilis and the semitendinosus, 2 of those hamstring tendons, through just a small incision on the inside part of your knee. And the third choice is to use allograft, which is tissue from a cadaver. And there's multiple ways to do that. You can use the patella tendon, you can use hamstring, you can use an Achilles tendon. There's lots of different options. So we discussed the pluses and minuses of all of those grafts. They all have their strengths and weaknesses. And in his age group, in his activities, we both felt that the allograft would work just fine for him. Certainly, I do all 3 graft choices, and we would have done any one of the 3 that he wanted, but he felt strongly about using the allograft, and I thought that in a 45-year-old would be suitable. So he underwent an ACL reconstruction with the allograft tissue, and he has just done phenomenally after the surgery. He is back to doing all the hobbies he likes to do and enjoy, and has had a very good outcome.
I had practically no pain from my surgery. My healing process, I didn't have a lot of pain at all. He listened to my concerns. I feel like he really listened to my concerns, and was honest and and gave me a real good assessment of what I could expect and where I would be at. And I think the treatment I got here was Class A. You know, I have no complaints about the way anything has went.